Friends and colleagues, it was bound to happen before too long. So I'm back, everyone. Mariah and Alexia, can you hear me?
Yes, we can hear you just fine.
Wonderful. I am so sorry. It's bound to happen at some time or another, and it did today. So I apologize, and thank you to the person who just put in chat. Really appreciate you guys sticking with us, and so we could keep going. Okay, let's get to the slide where I was. So as we were talking, the goals of the series are really threefold, and they really correlate and correspond with the three sessions that we have on turnover. So for one, we're looking to understand the impact of turnover, and I would encourage you. We covered that in our last session. If you haven't had a chance to join us for that session, or if you just registered for the series and that wasn't on your radar screen prior to this one, you can go back and listen to that recording on our website. Today, we are going to learn how to identify organizational risk factors contributing to turnover, and then next time, we are going to identify steps to reduce turnover. I'm Suzanne Speer. I'm the Director of Workforce Development here at ACU, and I'm thrilled to welcome back Alexia Eslan, and she is from John Snow Incorporated, and she is going to be joining us as a co-presenter and co-facilitator on today's session. And so with that, I am going to turn it over to Alexia, and she is going to go over some voluntary separation reasons and that contribute to turnover. So with that, Alexia, go ahead and take it away.
Wonderful. Thank you so much, Suzanne, for the intro. And Mariah, if you want to give me control, I can pass the slides, or otherwise I can just say next slide if that's easier. Great. Thank you so much. Okay, so during our webinar last week that Suzanne mentioned on understanding provider retention, we mentioned a few contributing factors that influence the provider turnover, including burnout, which Dr. Mack from HRSA talked about in depth, cultural and community fit, as well as relocation and family. Next slide, please. Oh, I think I have control now. Great. Thank you, Mariah. Okay. Let me go back. Okay. Great. So during today's webinar, we are going to be focusing on, okay. Apologies. I think there we're back. Okay. Okay, so during today's webinar, we're going to be focusing on the 7 factors that impact turnover that build and really align with some of what we started talking about during our last webinar. So these are compensation, professional development, healthcare community, practice environment, succession planning, work-life balance, and family. And we will be going into detail into each of these different 7 factors. Before we do that, I would like to take a poll and see which of these 7 factors affects your provider retention the most. So thinking of these 7, which ones would you say either from an analysis that you already conducted, or maybe it's a gut feeling, or just from conversations you've had? What do you feel is are the most the most typical factors that affect your provider retention? So let's take a minute to do the poll.
All right, sorry for the delay here. I just need to seize control back from you, Alexia, and then we'll get the poll going.
That would be great. And actually, Mariah, why don't you just keep control and I will just say next slide.
That works. All right, the poll should be up on your screens. If you always select all that apply, I'll give you a few seconds to answer. All right, I'll give us about 5 more seconds. Any last votes? Get them in. All right, and you should be able to see the results on your screens now.
Great. Okay, very interesting. Okay, so compensation about 50%, and practice environment 80, work-life balance 45%. That's really, I think this is what we see a lot of in the research as well. So definitely those three being the highest contributing factors, but family also 25%, quite high. And I'm excited to see there's a few succession planning as well, because normally in healthcare we don't pay too much attention to that, and it's a very important factor. So thank you so much for your responses. And Mariah, if you could go to the next slide, please. Great, okay, so let's dive into compensation now. And please note that if you have any questions as I'm presenting, you can chat them and I'll try to address them as I'm going through the presentation. And if not, we will have a Q&A session at the end where we can address additional questions. So for compensation, it's really important to consider all parts of compensation. That includes salary, bonus, any types of incentives, as well as the benefits you offer, including holiday, sick, and vacation time, insurance coverage, retirement plans, and others such as loan repayment, sabbaticals, etc. What you want to do is you want to compare what you're offering to your providers with local and regional benchmarks for each provider. Many of the primary care associations gather this information for their state or region, and so they're a great resource to get this data. In addition, I've used a lot MGMA as a national resource for benchmarks. The only thing is MGMA does focus more on providers in private practice and in large health systems. So you do need to look at kind of the median salary there and consider what are things that you need to adjust for given your setting. So if you're in a rural setting, you'll have to do adjustments or cost of living, depending on the state you're in. So there's, you could use it, but it definitely needs to be tweaked for the services that you're providing and the population that you're serving. Then it's important to see how each of your individual providers compares to these benchmarks, and then also how they compare to each other, given their experience, how many years they've been with the practice, and so forth. Of course, your limited resources might not allow you to have a higher salary, but maybe you could look at incentive payments or benefits to try to balance the other aspects of compensation. And in our third webinar, we will be going into providing examples of things that you can do for each of these areas. So today we're just covering the areas, and then we'll provide examples, more specific examples in our next webinar. Next slide, please. So professional, Mariah, oh, great, okay. So professional development, this is also another important factor, both for credit continuing medical education, so for CMEs, as well as informal, self-directed or point of care learning. These are very important to all physicians and non-physicians. The quadruple aim highlights the need to focus on care of the provider in order to effectively care for patients. That's that fourth aim. One approach to caring for the provider is investing in the continuing professional development. There's actually a study done by McMahon in an article that he wrote called The Leadership Case for Investing in Continuing Professional Development. And he found that investing in continuing professional development for providers and other members of the healthcare team can improve the patient experience, increase resiliency, and foster the delivery of safer, more efficient care at a lower cost. So I would love to hear from all of you. How are you supporting providers in their professional development? What kind of things are you offering? So let's take a minute, and if you can chat some of those responses. Great. CME allowance. Thank you, Katie. Okay, so you provide 40 hours of CME and cover costs up to a certain amount each year. That's great. You also have in-house training programs. It's really helpful. Sharon says, in North Carolina, we're looking to do more around this. We did offer a burnout prevention session at our medical director meeting. And also we did the session for HR. Yes, that's incredibly, that's great. So offering programs that address burnout and that have help with the balance with wellness, as well as offering CME and other in-house training. Nanette says we offer $3,000 per year for each provider and offer between 40 to 80 hours per year of additional time off for providers. Oh, that's great. It's really good. Time off is really important. And we'll be talking a little later on about the work-life balance. Educational affiliations from Yadira. Thank you. That's another great way of doing this. So thank you so much for sharing. These are all great ways of providing professional development and making sure that this is something at the forefront is very important. Andrea says, as a PCA, we have steering committee of multidisciplinary clinicians to guide PCA training for providers. That's great to make sure they're addressing issues. Yeah, that is really good. Thank you, Andrea. As well as you can have case conferencing and other ways for providers to share information with each other. Wonderful. Well, let's move on. Mariah, next slide, please. So in a cross-specialty national survey conducted by Mayo Clinic between September 2015 and April 2016 with 988 randomly sampled US physicians, the findings showed that competencies regarding medical knowledge and skills, wellness, informatics, so like the electronic health record and so forth, and practice systems improvements were rated the highest priority for physicians, while research, teaching, and professionalism were rated the lowest. The most important sources to identify knowledge skills gaps were immediate patient needs, personal awareness, and practice updates. Some of the most important barriers that were identified to accessing professional development were time and cost, which I think we all know very well. And really what they found was that there weren't many differences by specialty and practice type, that these were not statistically significant. So let's move on to our third factor. Next slide, please. This is related to the healthcare community in which your health center operates. So it is important to look at the resources available to providers and your organization in the community, including medical and surgical specialty services and behavioral and oral health services and others, and what processes and agreements are in place for your patients to access those services. In addition, partnerships and relationships with these resources are very important, both those perceived and actual. And the reason I mention that is because many times we might be operating under certain perceived assumptions when we might not double check to see those are reality. So those definitely influence partnerships and relationships that we have with the healthcare community around this. Another important factor is the distance to the hospital and other services, as well as the availability of providing alternative visits through, for example, telemedicine, which is now much easier to do given changes in policy and payment while we are addressing the COVID-19 pandemic. But it requires a close look for sustainability in the future. So how can we provide that flexibility and other access types? Next slide, please. Okay, so practice environment. This was highly rated by all of you, or most of you, about I think 85% it was, as one of the highest factors impacting provider turnover. So the practice, so we know this is extremely important. Obviously, burnout is part of this, and we did talk more about that in our last webinar. Taking a close look at your practice environment is not only extremely important, but also looking at, you know, specifically, what are the challenges and barriers that prevent providers and their teams from conducting their work efficiently. So here are a few things to consider. These include, you know, do you have a model of care in place and that really guides your team roles and workflows? The availability of practice partners and consulting specialists that can support providers in addressing whole person needs within a primary care setting, together with their clinical and non-clinical partners. Other things to consider are providers adequately supported by team members? Or are you having shortages or other barriers to getting the support needed? And I hear that a lot, that it's a big frustration when you don't have consistent support staff helping, as well as a strong qualified staff. What does your physical space look like? I do a lot of work in team-based care, and we look a lot at what that physical space looks like. Are you operating in a pod? And if you are, is the team sitting together? Do you have easy access to the patient exam rooms? Do you have the resources you need, the printer, fax machine, or those close by? Do you have the tools you need close by? All those components add up, and they can really be helpful or not. So those are things to consider. Also, what does the communication between the team members and with the patients look like? What does it involve? How are processes put in place to enhance that communication, that teamness, teamwork, and so forth? What about the electronic health record you use? I'm sure this could be a big barrier for many, and it's probably never going to be perfect. But what are, what are issues or barriers within the electronic health record that you can try to improve? What workarounds could you put in place that might help? Team dynamics, including with leadership. This is something that is a big contributing factor. And I wanted to mention autonomy here, because there's actually a study by the University of Virginia Health Systems that was conducted in 2014 that found that physicians had more job satisfaction when they had a higher degree of autonomy, allowing them to make their own decisions about what's most mission critical to achieve each day. So having autonomy over your practice is also an important factor, and it could influence those conflicts with leadership or management. The team dynamics, other important components to look at related to practice environment or workload. So how many patient visits does a provider have a day? How many days a week are they working? How much time are they spending with documentation, etc., as well as compliance issues. Next slide. I'm sharing this slide again. This was shared during our webinar last week by Dr. Mack, who is the Deputy Associate Administrator of HRSA's Bureau of Health Workforce. And it shares elements that HRSA is focusing on to counter physician burnout. So I wanted to reshare this today so you could see some additional components here and build on some of those that I just shared. Next slide. Okay, succession planning. So this one in our poll was at about 15%. So there were 3 respondents that said that this is something that contributes to their provider retention. And so succession planning is a structured process that incorporates the identification, recruitment, retention, development, and mentoring of high-performing providers and other employees within the with leadership potential in your organization. Succession planning, for any of the reasons listed on the slide, is another factor related to provider retention. And when you create a succession plan that highlights growth opportunities and challenges, providers and staff have a more positive outlook about their future at the practice of the organization, and really it contributes to them staying longer. I think of succession planning specifically related to provider succession planning in two ways. One is, how are you planning on replacing providers that are retiring or have an unexpected leave to minimize the burden on the remaining providers, team, and patients, as well as how are you incentivizing providers to stay at the practice by offering them possibility for growth, partnership, and leadership. So I truly see these two components of succession planning. When a provider leaves a practice, especially one who has been there for a long time or has held a leadership role within the organization, a lot of the intellectual property and important nuances that cannot be written down leave with a person. So an ongoing and developmental succession plan is critical to everyone's success. And just to note that the best succession plans are actually those that you are continuously updating and tailoring, given the changes that are happening and that are addressing new needs that are coming on by patients or changes in the environment. So things to think about with succession planning. Next slide, please. So I briefly mentioned work-life balance when we were talking about professional development. This, as you noted in the poll as well, is definitely a very important part of provider retention. So we've talked about burnout, which is not only affected by the work environment, but also on that balance that you have with your work and personal life. And I think as employers, many times the focus is more on the work side of things, but ensuring that there's processes, policies, schedules, and benefits that also address that balance is an important factor in decreasing provider turnover. And I was glad to see in some of the things that you were chatting that there's definitely that you are looking at that and providing incentives for providers to have more of that work-life balance. So here on the slide, there are a few things to consider. The first one is the availability of relief coverage for vacations, holidays, and family emergencies. This is extremely important. I have a good friend of mine that is an internist and a pulmonologist, and she hasn't taken a vacation in 10 years. She conducts research and she sees patients, and she just doesn't have coverage for her to leave. So if she leaves, things fall apart. And that's not sustainable. So really looking at how can you provide strong coverage so people can be able to address those needs that come up or take some time off is important. Provider coverage and call schedules. So how often are providers on call and how are their schedules rotated throughout all the providers is another important factor. I used to work at Kaiser Permanente, and we had locum providers that were on call, and that minimized the burden on the primary care providers. So are there ways that you could try to minimize that burden? And then, as we mentioned earlier, how many hours are providers working? And that includes the charting and other administrative responsibilities, as well as their patient visit time. And then also, how much flexibility do they have in their schedules? I know that we don't want to be constantly changing schedules for provider needs, but making sure that there's a balance there where there is some flexibility as well as some consistency, looking at it from the patient perspective. Next slide, please. So this is the seventh factor that I mentioned that I wanted to address today. And this is very much related to the last one on work and personal life balance. So what resources are available to the providers and their families really does influence provider retention. Is there access to high quality schools and housing close by? Are there employment opportunities for spouses or partners? And if not, do they have the ability of working remotely? And I think that's going to happen more and more. And so that's going to be something to consider as well. Are there resources in the community to support the needs of their families, to support the needs of their children as well as themselves? Those are all important components, and they help support the provider decision-making about staying at the health center. Next slide. So again, I covered these 7 main factors on provider retention. And as I mentioned, we will be providing more examples in our next webinar. But I wanted to hear from you through the chat if there are additional factors that you are looking at when you're analyzing retention, or can you think of that I have not covered, that were not covered within these 7 main factors. So let's take a couple minutes if you want to send those via the chat. And also a reminder to please send any questions you might have via chat as well. Or maybe these 7 factors cover most of it. Oh, great. Okay, productivity. Great, Chris. So tell me a little bit more about productivity. Is it how many visits they have a day? So how much workload they have? Or if they're productive, then they're able to have more satisfaction with their work, which could then increase provider retention. So comparing individual provider productivity to standards for comparable services and lines. Definitely, that's a great one. And that could fall within that practice environment as well as compensation, because you might be compensating or providing bonuses to providers depending on their productivity. So those are really great factors to bring in. Great, so that could be used in planning when to expand service lines. Great, thank you for sharing, Chris. Sharon says, I believe this covers all the bases. Yes, there's definitely a lot here. And I'm gonna hand it over to Suzanne now, who's gonna be covering the turnover tool. And please feel free to continue chatting different ideas or thoughts, as well as any questions as we are going through.
Great. And Mariah, you can go forward about 2 slides if you wouldn't mind. Thank you so much, Alexia. I really appreciate you going through all of those factors relating to turnover and why people leave health centers and health center organizations. So, you know, part of this series and part of what we are doing here at the STAR Center is the development of a turnover tool. And Mariah, you can go to the next slide, please. And so, go back one more. So sorry. Oh, sorry. Didn't have that slide. You can go to the next slide. So a couple of reasons that we have developed a turnover tool are to identify strategies that might help improve success with provider retention, and talking, you know, we're going to talk a little bit more about that next week. And then also too, we really wanted to provide you all at health centers with individual results for your organization and what and what's going on there. We also wanted to provide brief recommendations with turnover, what you might do to combat those, especially with those 7 reasons why people are leaving, and to give you some ideas about things you might do to combat that turnover. And then also, finally, and we're going to talk a little bit more about this in a minute, allow for the collection of turnover data, because right now that doesn't exist. So with our turnover, for this turnover tool, it was really designed to help you guys determine several measures of turnover. So as you can see here, there's a bunch of different types and measures of turnover, and we're just going to go through them one by one here for just a minute. So first of all, you are going to go through the percentage of vacancies by provider type. And that provider types we have in the next slide, but we're not going to get to that just yet. But we're going to take a look at all the different provider types. And a lot of times, one of the things that we talk about so much, and that is in our turnover tool, are physician and non-physician providers. This is going to expand a little bit more and really go through a lot of different provider types that we'll go through on the next slide in just a minute. We're also going to take a look at average length of vacancies. So when you gather this data, it'll enable you to take a look at how long those vacancies are open. So then it can help you in that strategic planning process that Alexia talked about that's so important. And so if you know that you have an average length of vacancy and you know somebody is going to leave, you can start advertising for that ahead of time. Obviously, you can't do that in every situation, but if you know that your average length of vacancy for a physician is 8 months, then, and if you know somebody is going to be leaving because of family or whatever, then you can prepare for that and start advertising ahead of time. It also takes a look at the percentage of voluntary versus involuntary separation. So those people and those staffers who leave because they wanted to, and those that you need to dismiss because of any other amount of reasons. So really taking a look at that, which is interesting to see, what amount are leaving because they want to, and then what amount are leaving because they just weren't a good fit for the organization for whatever might be the reason. So looking at those and comparing those two. Also, average tenure. This is another really interesting one because you can take a look and see, okay, well, for physicians and other types of providers, our tenure is we're really pleased with that and really excited about it. And then something else like an MA, it might be kind of low. And so you can think of that as sort of and enables you to really hone in on the types of turnover that you're looking at. What types of things do you need to put strategies into place to really increase that tenure by the employee type. Also, too, estimated cost of vacancies. We went over that yesterday in the turnover tool, but this goes even further. So the turnover tool is great, and the financial impact, the financial impact tool that we went over last week is really a wonderful thing. It goes and takes into consideration all of those costs, right? And this really goes sort of one step further and provides the cost of the vacancy itself. So really goes and does a lot of different things, encompasses a lot of different information, and we think that it'll capture turnover as it relates to all the different factors at your organization. So next slide, please. As I mentioned, our financial impact tool that I went over last week collected and looked at separation and turnover for physicians and non-physicians. Again, this one goes several steps further than that. So it takes a look at primary care physicians, and not only does this look at family medical doctors, internists, but also collects information about OBGYNs. We include that in primary care as well. It looks at primary care advanced practice. So physician's assistants, nurse practitioners, as well as certified nurse midwives. So we also include that women's health piece in there because we think it's an important part of primary care. We're also looking at dentists and dental hygienists as well. So those people who are providing primary dental care as well. Then taking a look at mental health practice, and it breaks it down into two different two different types, both the doctoral level providers, which are psychiatrists and also psychologists, PhD psychologists. So anything that's really above that master's level, and looking at that into the mental health doctoral level, as well as mental health advanced practice. So there is a slew of advanced practice providers that are in the mental health space, right? So including psychiatric mental health nurse practitioners, master of social work, licensed clinical social workers, master's level psychologists, all those different types of advanced care practice and mental health. We include that in our data collection as well. Primary care clinical support staff, so this could be an MA or an LPN, those who are on the clinical side but still support staff, and then also dental assistants. So really it encompasses a lot of different things. You may have, especially when it comes to the advanced practice ones in the primary care and mental health space, you might have all of these, you might have some of these, and that's okay. Really the goal is just to capture what are in those particular categories, and we included those there just so it would be a prompt for you all when you're filling out this tool. Okay, and if you wouldn't mind going to the next slide, Mariah, please. So if you take a look at the tool and really what it does, you're probably thinking to yourself, well, why this turnover tool? Why now? Well, again, I went over a lot of different reasons previously, but I think one of the number one things that we, along with to have organizations take a look at their turnover, take a look at their data, analyze it, why are people leaving and what can we do about it? One of the biggest things that we said was, nobody is collecting turnover data, and we think that this would be a great opportunity to do so. So I don't know about you, and you can put it into chat if you're excited to have a set of turnover data, but we are personally excited to have turnover data available to us. And it is going to be collecting on a rolling basis by year. Now, this is completely voluntary. It's not going to be something that you're required to do or you're able to do, you know, like UDS, where it has to be done within a certain length of time. You can do this at any time during any, you know, any time of the year. And generally speaking, so if you filled it out now, it would be for 2019 turnover data, because that was the entirety of that you had turnover for. But again, collecting on a rolling basis for, generally speaking, the year prior. And this is also going to allow, this turnover tool is going to allow us for the aggregation of data and determining benchmarks as well as training needs. So with no nationally available turnover data for health centers, it is a hit or miss. When, you know, there are a lot of things that we can infer about turnover data and what the training needs are, but this is really going to allow us to really hone on what the training needs are for you guys and to be able to, you know, share it with our partners. And, you know, I will say that when you fill this out, the information is confidential and it's only shared with the primary care association in your state if you agree to have it shared, right? So there is a little opt-out section of our tool where you can say, no, I'd rather not share this information with our primary care association, and that is absolutely okay. If you want it to just stay with us, that's totally fine. But, you know, and we're not going to share your individual data. It will allow, and I will sort of put this as a caveat, is once we get enough information by state, by region, and nationally, we will be able to aggregate the data. So even though we're not sharing out your personalized information, it will allow, excuse me, I'm tongue-tied. It will allow us to aggregate that data and to be able to have those benchmarks. We get asked a lot more than you would probably think for turnover data. Do you have turnover data for health centers? Do you have it, you know, for our state? And there are some states that do collect this, but more often than not, there aren't as many states that are collecting this from their PCAs. So it's going to be able to really allow us to aggregate it, to give it out as a benchmark, and to use that. So we're super excited about that. And Mariah, if you wouldn't mind going down 2 slides, that would be great. So I'm going to walk you through, now that we've gone through sort of what it is and why we're doing it, I'm going to take you through a virtual walk. I'm not going to live demo it today, but wanted to walk you through it virtually. So as you click on the web link that we are actually going to be sending you after this, after today's session, you are going to go to an overview screen. This overview screen is going to go over several different things. It's just going to give you an overview, how to use this tool and what it's going to be used for, and also is going to talk a little bit about the confidentiality about it, sharing it with your PCAs or not, and how all that works. Next slide, please. Then once you go to next and start the tool, you're going to come over to this screen where it's going to ask you some really just some overview details, right? Your name, phone number, email, what year you're collecting it for, your health center name, how many FTEs you have, what your health center budget is, what your state is, and then it's going to ask you how many sites you have. And I will note that if you are going to complete it for both your health center and your individualized site, you're going to need to complete it a couple times. So if you have 5 sites you want to complete it for, you're going to need to do the tool 5 times. There's just, there wasn't a great way for us to do it for each individual site. So you can either do it for one site or for your combined site. So if you have 5 combined sites and you're not breaking it to turnover data down by site, you can you just do it in aggregate there. Right, if you wouldn't mind forwarding it as well. Thank you. So this next screen is going to come up and it's going to look at specifically at physician turnover. And we included the definition of that for every single provider type and for each individual provider type that I went over. So physicians, primary care advanced practice, mental health advanced practice, all of those different types. You're going to have the same screen for each of those. And it's going to take you through the positions, the FTEs, all of the different, the tenure, all of those different informational questions it's going to ask you. It's going to ask you for each individual provider type. And so then you can take a look at those by discipline and again, really help you to pinpoint and see where your turnover is, is the highest percentage and where it's the lowest percentage and where you might want to be looking towards putting those measures into place to really mitigate that turnover. And then Mariah, if you wouldn't mind advancing, please. Great. So, and then once you get through all of those different provider types, you are going to get to the voluntary separation reasons or those contributory reasons, that's hard to say, that Alexia just went over. And so you're gonna have a chance to go through all of the different 7 factors and click which applied. Now, I will note that all of these different items are aggregated. So you won't do it by individual provider type, but just why are people leaving your organization in general, whether it be an MA or a physician or a mental health provider. So this really aggregates it, and you can take a look at why people are leaving your organization voluntarily. Obviously, this is not involuntary separations, but the voluntary separations. Number 8 is actually a free form where it says other. So when Alexia said, do you have any other reasons that are contributing to turnover? We give you, even though there wasn't much of, many reasons that were brought up here today, there might be something else that comes up between now and then when you fill this out. And so you're able to capture that as a part of the turnover tool. And it's also going to help inform us. So if we see a lot of something that comes up in number 8, then we might add this to the tool later on. Next slide, please. And then once you take it's going to take you about 30 minutes to get to this tool, you're going to get your results. And you're going to get your results via email. Once you hit submit, you're going to have a little box that says, thank you for submitting your information. And then it is going to come to you via email. So whatever email you put in on the first page, as the email, that's who it's going to come to. So if you are the HR manager or in HR and you want it to come to you, make sure you put your email in there, and it's going to come to you, and then you can forward on the results. So the results page is going to be sent to you in a PDF, and it's going to include all of your results. It's going to put in nicely aggregate everything that you put into the tool, and it's going to put it in one nice PDF for you. If you could go down to the next slide, please. Along with all of your answers, you are also going to get an action guide. And this is going to be sort of a where we go from here, right? And a lot of this, Alexia and myself, we're going to be talking about that next week. But it's really where we go from here. How do we interpret this data? How do we, what do we do from here? What are our next steps? So that's going to be our action guide. Next slide, please. And it really goes through, next steps. Talk about it. How do you share your results with your team? How do you share it with your managers? And then also, communicating your successes in regards to turnover. All of those are important steps. And it walks you through each of those things that you should be doing. I know a lot of times we, develop tools or different resources, and people are like, this is awesome, but where do we go from here? So this action guide is to hopefully help you take at least the first steps in sharing this data and helping you go take your first steps into reducing turnover at your organization. So it also gives you a next step section where you can write out what you want to do next, and based on that feedback, where you want to go from here. Next slide, please. So the third part of the PDF that you're going to get after you submit this are some additional resources, and these are a bunch of links that you can check out as the different types of information that we have. So you have helpful links and resources, reading warning signs on burnout, and also employee satisfaction. All of those things that it might be helpful to you as you are trying to figure out where you go from here and taking steps to reduce turnover and burnout within your organization. Next slide. So what now? Where do we go from here? We talked about the reasons that people are leaving. You showed us that tool. What now? Next slide. Well, let me tell you our next steps. So in a few days, you are going to receive an email with a link to our brand new tool. This is hot off the presses. It hasn't even landed publicly on our webpage yet. And you all are going to be the first ones to be able to utilize this tool within your organization. So you're going to receive an email link to the brand new tool along with the recording of this session and also the slides. Next, we want you guys to complete the tool for your organization. We want you guys to take it for a test drive, see how it works. Obviously, we've already beta tested it within our organization, but we want you guys to take it and, as you're looking at turnover to your organization and how you can combat it, it would, just go ahead and take that for your organization. And then once you've completed that and you have your results in hand, we want you to come back on June 3rd, and that's in 2 weeks. We're giving you an extra week to do some homework, if you will. I know that's not maybe what you're expecting today, but we are going to give you a little homework, and then you can come back in 2 weeks and talk about how you combat turnover. So we're going to be taking a look at some ways to mitigate some ways to mitigate turnover at your organization, and really what you do with that data that you're going to have as a result of this turnover tool. So really it's a 3-part sort of assignment there, and we're excited to share this tool with you and to get it out into the world, and to also to start aggregating that data so you guys can have some benchmarks that aren't, that you don't have available with your PCAs to really check out some nationally available data on turnover once we have enough to aggregate it. So if you guys would be so kind just to help us with that, we would love to be able to share that with you guys as well. Next slide, please. And so, as I mentioned before, our next webinar is going to be identifying steps to reduce turnover. And next slide, please. on June 3rd. So with that, we have about 4 minutes for questions. And we would love for you guys to ask either myself or Alexia any questions that you might have about today's session, or anything that you didn't get to ask last time. And you can put those either in the chat or the questions box. I've got both of those up so I can see those with you. And as always, if you have questions you think about after the session, you can feel free to email us at info@chcworkforce.org, and we would be happy to answer those for you. So I'll give you guys just a few more minutes to ask questions. And we just have one that came in. Okay, this question asks, can health center participants fill out the turnover tool both for their organization overall and then individually for the site? This is meaning you'll have double the data for that organization. Yes, absolutely they can. If you would like to look at it from an individual organization, excuse me, an individual site, that would be fine too. And we'll take a look at that as we're aggregating the data. We will take a look at that, a site versus organization as well. So great question. Yes, absolutely. Okay, so while we're waiting for any other questions to come in, Mariah is going to launch our poll. And we would be so grateful if you guys wouldn't mind taking that poll as you are getting ready to jump off this webinar today. And I just want to say a big thanks to Alexia for co-facilitating this session with me, and also to you guys for joining us, as well as bearing with us with these just crazy glitches that we had today in our technology. So I'm glad that we were able to get it fixed and had the rest of the session without any other hiccups. So thank you guys for joining us today. Please fill out the session evaluation before you hop off. And we look forward to seeing you on June 3rd for our last session. And in the meantime, again, stay tuned to your inboxes for the link to the turnover tool. So thank you, Alexia. Thank you to everybody else, and have a great afternoon.
Thank you, Suzanne, and thank you everyone for being on the call.